Hi folks, Dr. Craig Steingraber again. As we're going through these series on pain reduction and the different ways or different things that can cause it and the different ways we can reduce it and help manage it, especially chronic pain, we're going to go off into the increasing motion and flexibility part of things. Now, I think it's very important for me to preface as we start to say, well, how can we increase motion and flexibility in various ways, that this is pretty much the reason why we do it. In muscles and tendons and ligaments of our body, we have certain kinds of nerves that carry certain types of nerve signals, and I'm going to call those motion nerve signals. So there's only certain types of nerve signals that exit out of these types of tissues, they're called connective tissues, that only carry the sensation of motion. So if I was to ask you to close your eyes and I would move your arm up or down, you'd know which way it went. You didn't see it, but you felt it. That's because I activated these kinds of nerve signals. Once these nerve signals hit the spinal cord, which carries messages to and from our brain, once it hits areas of the spinal cord, they immediately start becoming pain relievers in almost every case. We'll talk about the few cases that it makes it worse later. But in almost every case, so by increasing motion of these tissues, once it hits the spinal cord, starts decreasing pain. As those nerve signals go up into the brain, there's many different brain regions that these nerve signals go into that also have to do with decreasing pain. Then these certain nerve signals come back down in this way. This is going up, this is coming down, and once it hits certain areas of the spinal cord, there's additional ways that it starts decreasing pain, pretty much for any cause of the pain to a great degree. So we'll start going off here in the next weeks into how we can improve that so this happens more. We'll see you then.